Hospital workers, many of whom are here, but your colleagues as well, are feeling burnt out from this. It is clear that that's the case.
BC's health minister announcing more staff and more services at Surrey Memorial Hospital after doctors sounded the alarm on a crisis at the city's stretch-thin care centre. Doctors say some patients were waiting up to 3 days for a diagnosis.
And there's the immediate action to support the hospital here today, the work we're doing with hospitalists, the work we're moving in the emergency room, the immediate action in the hiring of staff and supports for maternity, for cardiac, and for mental health and addiction services in other parts of the hospital. They're part of the immediate plan.
Dick says the province is refreshing how it plans medical services in Surrey and Delta. He says that includes putting more physicians in the Fraser Health area, with Surrey Memorial Hospital as their home base. In the medium term, an upgrade in key services at SMH like kidney care and heart care labs, new MRI and CT scanners, and finishing operating room renovations.
I'm pleased that the minister heard the calls, the cries from the doctors and the nurses and the families. I'm very pleased he heard that cry, but I can tell you the need is great, the need is immediate, and we are hopeful that we will see more on the horizon.
In a statement to City News, the BC Nurses Union says in part it welcomes the announcement and it will be following up with our members to monitor the extent to which these new measures are actually improving working conditions and providing the relief the emergency department needs in order to provide the level of care patients deserve. Wednesday's announcement to expand Surrey Memorial adds on to the province's commitment to build a second hospital in Surrey, the health minister acknowledging it needs the capacity.
Surrey Memorial Hospital takes everything, which sometimes negatively affects its ability to expand for specialization.
But I do know, in talking to some doctors, that I've already heard that they think this is not near enough. But we do have to keep this ball rolling because the South Fraser and Surrey especially, the pressures on our city for healthcare infrastructure are just tremendous.
In Vancouver, Kier Junos, City News.